memedicine Cram Electrocardiogram Flashcard Set 14 Atrial Flutter. This deck of cards can be used for review for the National Council licensure examination. What criteria will the healthcare provider use to identify atrial flutter for a patient on a cardiac monitor? Select all that apply. A P to QRS ratio of 1:1. B, a PR interval that is not measurable. C, presence of sawtooth wave patterns. D, the QRS complex is normal. And or E, irregular RR intervals. Just for more guidance, this is what the EKG of an individual with atrial flutter would look like. All right, so I'll give you a moment to select the correct waveform patterns. Okay, so in order to answer this question, let's just go over a little bit of background on atrial flutter. Atrial flutter is usually caused by irritable ectopic depolarization in the atria. Usually, the ventricular rate is regular, so the RR interval would be normal. Okay, so that means answer choice E is out. And the atrial rate is usually 250 to 450 beats per minute. And this is so fast that the AV node can't conduct all the atrial impulse pulses to the ventricle. So the ventricular rate is usually 75 to 150 beats per minute. Okay. And the PR interval is not measurable because it's buried in the multiple flutter waves due to the atrial fibrillation. That means that answer choice B is a selection. Overall, the characteristic pattern in atrial flutter is the presence of sawtooth wave patterns, kind of like this. Somewhat normal QRS complexes, regular RR intervals, and a P to QRS ratio of 2:1, 3:1, or even possibly 4:1. Hence, the PR interval is not measurable. All right? So I'll give you a moment to take this all in.